I just thought I should sort of give a presentation on how we could embed the social sciences in AMR Genomics. Very mindful of what we call the social sciences, and it could be very broad, as you have just mentioned earlier. But it is important also. I think Greg started his presentation by giving us various behavioral practices that could lead to antimicrobial resistance, and the importance of sort of centering those different practices when we do AMR genomics research, or whether it's for public health surveillance. So I just want you to imagine a scenario mainly around the politics of pathogen genomics. And so I thought of putting together some actual challenges in AMR genomics, especially in the African setting. So if you think of a district hospital in a farming town in Cameroon, and you can replace that with your own country or setting, and doctors are alarmed by the sudden rise in neonatal sepsis cases. And blood culture isolates shows that it's Klebsiella, and that it is resistant to all the available antibiotics. The hospital is part of a national genomic surveillance initiative that is part of a global health consortium with a European research partner. They have confirmed the hyper-resistant clone, and they have mentioned that it was previously detected only in Asia. And within weeks, veterinary officers in nearby farms also report a rise in piglet deaths. And sequencing also shows that it is linked to the same strain of the Klebsiella. So, but instead of triggering or instead of starting a coordinated response between the different sectors, which will be health, agriculture, scientific research, there is no response at all, mainly because there is a fracture in who will lead the response. There is no data sharing plan, and there is confusion about who should lead the response. Should it come from the Ministry of Health or from Agriculture? And the local researchers in the university think that they should be able to use the data to inform scientific research. And because they are unable to access the data, the question why that data is sitting in European servers. There's also a growing mistrust across sectors between the farmers, the academics, and the Ministry of Health. And they think that it is the farmers think that they are being targeted for political gains because they want a particular sector to provide antibiotics. So there is growing mistrust both across sectors, health, the universities and agriculture, and the markets, and even within and in the public. So if you imagine such a scenario and you are a researcher involved in the public health response, what do you do? So I thought I should just give some context for this case, that in many African countries, antimicrobial distribution occurs through informal markets with minimal oversight. And there is political interest, there is market interest on who distributes the antibiotics. There are weak enforcement of veterinary regulations that permits overuse in livestock. There's lack of clarity on how clinicians will navigate ambiguous prescription policies. And it is not clear how farmers access antibiotics in the absence of oversight for veterinary services. There are also questions in the academic sector: who controls genomic data, how it is shared between countries, and who should lead the agenda. So basically, sequencing can reveal that there is the resistant strain, but the real challenge is not in the science. It's not that the data is not available. it's mainly in the social and institutional response. So AMR genomics can give us precision data about genes and transmission patterns, but it doesn't tell us why antibiotics are misused or why policies are ignored or what behaviors are making sure that this resistance persists. So why is it important to embed the social sciences? I think Greg started talking to us about that. But AMR is much about people as it is about pathogens. So while genomics may tell us what pathogens are circulating and how they are evolving, it doesn't tell us why resistance is emerging in specific places just across the river from one village to another, or or how to intervene. And it is important to realize that AMR does not occur in a vacuum. Its emergence and transmission, they're embedded within very complex social and ecological systems. And that to effectively mount a response, you need to take these different social and ecological determinants into consideration. And sometimes it could be factors such as overcrowding, poor sanitation, informal livestock rearing and how they use antibiotics, uh, low literacy on antibiotic use, and just how people in different settings are able to access antibiotics in informal markets. So I already talked about these different social and economic and ecological determinants of the microbial evolution and AMR, and how culture and social practices also could lead to antimicrobial resistance, including looking at how gender norms could affect AMR resistance in terms of risk of infection, access to treatment, and misuse of antibiotics. But most importantly, and that seems to shape the discussion around AMR genomics now, is the biopolitics of pathogen data sharing. And this is not only across borders, but also across sectors. So who owns, in the case of AMR resistance, or who owns genomic data, who gets access? How do you manage issues of benefit sharing? Is it within communities or with sectors or with nations? How do you do it and when do you do it? And who and which sector should drive the response? I think it's always been that the public health sector drives it, but we clearly see that other sectors could actually want to drive the response, from agriculture or the academic sector. And what's the way forward? I think we all agree that there is need for interdisciplinary collaboration, but we need to embed social scientists in AMR genomics from the very beginning. It shouldn't be an afterthought. And there should be infrastructures and resources to support that. So adequate budgets. So when you think of how you plan data sharing and all, and the resources that go into that, also think of the social science response. And funders need to think of an integrated approach to AMR genomics and actually invest in that. And it looks to me like more emphasis needs to go on the governance of pathogen data sharing and how to navigate the politics that comes with that. And much effort needs to go into public engagement. Why do AMRs persist? And how do we leverage on the genomic data to inform the public health response? And it seems easy, but interdisciplinary collaboration is very tricky, especially if you're a social scientist sitting within a biomedical team or biomedical department. It's very hard to do interdisciplinary research. And I think that I didn't want to, Paul already has a webinar on this, on the challenge of delivering transdisciplinarity within AMR research. And so I will leave that because it is publicly available. And yeah, so thanks, and I look forward to the panel discussion.